Okay, sir.
Okay, how many guests joined for?
Sir, two guests.
Echo is there. Echo is there.
Two guests have joined, sir.
Okay, then who are they? Dr. Prashant.
Prashant Argade, sir.
Yes, yes. Then,
And Shiv Kumar Gore, sir.
okay, good morning, Argade sir. Good morning, Gore sir.
Good morning.
Can we start now? Because as per our protocol and program schedule, it's 10:30, I think.
Yes, sir.
Yeah, please start.
Okay, sir. Respected Principal, Dr. Rupesh Pingle, sir, distinguished speakers, faculty members, and my dear students, a very warm good morning to all. I, Mrs. Pratiksha Vasankar, and I feel very privileged to welcome you all on the behalf of NCRD's Institute of Pharmacy in the inaugural function of the state level 3 days webinar series. Let's inaugurate the program with curtain rising ceremony. Every occasion, as per the Indian tradition, begins with the invocation to the Almighty and lighting of the lamp. So let's begin with the Saraswati Vandana and virtual light lighting ceremony.
गुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं गुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते शुभं गुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं गुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
With this blissful beginning, now we move forward. For this 3 days webinar series, we have very eminent speakers, and now it's time to felicitate them virtually by our principal, Dr. Rupesh Pingle, sir. So, first, we would like to felicitate Dr. Snehal Kohale, ma'am, consultant, fertility specialist from OVA Fertility and Women Care Center, Thane. Thank you, ma'am. Next, we would like to felicitate Dr. Harshal Pawar sir, Assistant Professor from Dr. L.H. Hiranandani College of Pharmacy, Ulhasnagar. Thank you, sir. Next, we would like to felicitate Dr. Prashant Argade sir, in charge HOD from Department of Pharmacy, Government Polytechnic, Jalgaon. Thank you, sir. Next, we would like to felicitate Dr. Shivkumar Gore sir, Ayurvedacharya from Anupam Ayurveda, Shendra MIDC, Aurangabad. Last but not the least, we would like to felicitate Dr. Krishna Deshpande sir, General Medicine Consultant and Physician from MIT Hospital, Aurangabad. Thank you, sir. Next, dear participants, educational institutes are now facing many challenges and many challenges and issues due to COVID-19 outbreak. Outburst of this COVID-19 pandemic in many ways have changed the definition and dimension of the existing teaching and learning methodology. In this time, virtual platform like webinars, EFDPs are playing major role in providing useful knowledge in the education. As we all know, the syllabus of the D Pharmacy course have been changed from this year, and as per ER 2020, many new topics are introduced in the syllabus. So to give the brief outline about these topics, our college have organized this webinar series. As per the famous quote, education is the passport to the future, for tomorrow belongs to those who prepare for it today. Education is the most powerful weapon and we can use to change the world. Now the person who has consumed himself to change the society and light the darkness in the life of the students, the principal of NCRD's Institute of Pharmacy and convener of this program, Dr. Rupesh Pingle sir, is requested to address the audience. Over to you, sir.
Thank you, Pratiksha. On behalf of NCRD's Sterling Institute of Pharmacy, I heartily welcome our eminent speakers, Dr. Snehal Kohale, Dr. Harshal Pawar, Dr. Prashant Argade, Dr. Shiv Kumar Gore, Dr. Krishna Deshpande sir. From your busy schedule, I just able to see Dr. Krishna Deshpande sir is also joined, and he is, I think, busy in his OPD. And I'm very much happy that from your busy schedule, the eminent speakers are joined for the inaugural function also. Even Dr. Dr. Shiv Kumar Gore sir is also there. I welcome you all, sir, all the eminent speakers, okay, for the sparing your time for this function, inaugural function and 3 days webinar series. All the faculty members from various institutes joined for this webinar series, and students from the various institutes for this 3 days webinar series. Dear students, our institute is established in 2003, and from 2003 we are taking maximum efforts to develop the students not only through the academics, but apart from the academics, extracurricular activities or the different types of webinars, different types of seminars, workshop, paper presentation competitions are arranged in our institute. The aim behind this arranging these various types of guest lecture and this competition is to develop the students in 360 degree. Listen, only the degree will not solve your purpose. What knowledge student is having, that plays an important role while getting a job and while surviving in the market. So to consider this thing as the curriculum is changed. Now we used to have ER 91, Education Regulation 1991, and from 1992 we used to teach the same curriculum, and from this academic year the Education Regulation 2020 is in force from the Pharmacy Council of India, and there are n number of changes in the curriculum. There's very specific changes which can be important according to the society point of view is the social pharmacy. In social pharmacy, this subject is mainly related with the health issues, okay, and the awareness among the pharmacy students because they are the bridge between the doctors and the patients. Pharmacists plays important role between the doctors and the patients, so they must know the basic things which are which can be handled by the pharmacist. Every time it is not possible for the patient to go and visit the doctors. That's why patient counseling, and then even the CPR techniques. Okay, these are the few examples which are there, and our eminent speakers will explain you this thing, and definitely this will solve the purpose, and this will helpful for the student to learn the techniques, because the techniques, for example, very simple CPR technique can save the life of patient. If patient is suffered from the cardiac arrest or the MI, in that case, if CPR technique is known by these pharmacists, that may be helpful. The important topics from the Dr. Prashant Argadeswar is green chemistry. Now we used to learn various news from the newspaper. Recently, Maharashtra government took one decision that the chemical factories which are there in the Dombivli MIDC area, that due to that pollution, there are n number of problems in the Dombivli Kalyan area. Might be rain with a pink color, green color. Okay, and this pollution is hazardous. And as we know that this COVID situation, direct COVID is directly affecting coronavirus is affecting on the lungs. So ultimately, pollution and this viral infection are causing a lot of problems in the community. So the green pharmacy, importance of green pharmacy is very much essential to reduce the pollution level in the climate. Okay, and in COVID situation, we maximum population used to take the Ayurvedic medicines to boost the immunity. So definitely this will be a very interesting subject from the Dr. Shivkumar sir. And apart from this, we have Dr. Krishnan Deshpande sir is a MD medicine. So definitely, what is the good thing, especially the if you see the community. Now India is having, I think, on third number considering the diabetes population in the world. We are on the third number, I think. So, what lifestyle changes which are essential to be changed by the patients or to change by the community, that can be guided by the Dr. Krishna Deshpande sir. And the main objective of this our 3 days webinar series is to give you aware, to make aware the students about nutrition, importance of nutrition, exercise, and immunity boosters in COVID-19. Exercise, nutrition, and immunity boosters can definitely give immunity or can definitely fight with the COVID infections. Okay, this which we learn in last 2 years. And apart from this, in social pharmacy, women related health issues, okay, everything which are there. And dear students, this is my suggestion to you. Don't shy to ask the questions. I am expecting at least each and every student is not possible for the to convey your questions to the speakers, but through your as I think faculty might be explained with the process how to ask the question. But please ask the question and get your problems or get your queries solved from these eminent speakers. The role of the women health is the major issue, and which cannot be discussed on any platform, because we always think that issue should be restricted to some extent. But you are as we are working with the community, we are working as a bridge between the society and the doctors, so we should know the basic things about the women health issues and all. So dear students, this is my request to you to ask maximum questions to our eminent speakers and get your queries solved. Once again, I heartily welcome you all, sir, for sparing your time for this inaugural function also. And I hope all the students, faculty, we all will learn a lot of things from this 3 days webinar series. Thank you, sir. Thank you very much.
Thank you so much, sir, for your very thought provoking address. Now it's time to start our very first session, and for this, I request Mrs. Swati Dusane ma'am to take the charge for the next session. Over to you, ma'am.
Am I audible, Pratiksha?
Yes, ma'am.
Thank you, Pratiksha. Good morning, one and all present here. I am Mrs. Swati Dusani, lecturer, NCRD'S Institute of Pharmacy. Welcome to all in 3 days webinar series. It's my honor to introduce today's eminent speaker, Dr. Snell Kohale ma'am, who will speak on topic an overview of women health issue. Dr. Snell Madam has completed MBBS from PG Medical College, Pune. She has completed MS from SET GS Medical College and KM Hospital, Mumbai. She is DNB in Obstetrics and Gynecology. She is a member of Royal College of Obstetrics and Gynecology, London, UK. She has received fellowship in reproductive medicine at Bangalore, Assisted Conception Center under Padma Shri Dr. Kamini Rao. She has awarded certification in oncofertility. She also received advanced skill training in fertility, ultrasound, and high-risk obstetrics. She has worked as an assistant professor at Grand Medical College and Sir J.J. Group of Hospital, Mumbai. She has received appreciation award in recognition of valuable service, conduct, and commitment to patient care by hands of Karnataka Medical Education Minister D.K. Shivkumar at Bangalore in November 2018. She has worked as teaching faculty in fertility and ultrasound training courses, paramedical staff training courses, and communication skill workshop and faculty at many conferences. She has many publications in index national and international journals. She has presented paper on PLGF biomarker study at New Orleans, USA, and intrauterine GCSF fluids study at PCS conference at Budapest, Hungary. Once again, I welcome you, ma'am. Now, I request to Snell madam to proceed the session. Over to you, ma'am. Hello, ma'am. Over to you, ma'am. Dr. Snell, ma'am.
You can send text or you can call madam.
Yes, sir.
Good morning, sir. Actually, madam have some problem related to that sound. She is checking that, and she will take around 5 to 10 minutes, and then she will come back.
Hello. Yes. Thank you, Navi. Hello. Good morning, everyone. Sorry, there was some problem from my end about the sound. Good morning. So thank you so much for a very kind introduction. I'm Dr. Snehal, and today I thank organizers to give me this opportunity to talk about the women health issues. So without wasting much time, I'll start my presentation, but I will request all of you to have, an interactive session. So you can, meanwhile, if you have any queries while I'm presenting, you can mention in between, or we can take question answer session at the end. You can keep your questions ready, because I don't want to bombard too much about by giving too much information, but at least we will understand like how important is women health. And in general, of course, health is a very important thing. I'll just share meanwhile my presentation. Just a second. Yeah. Okay. So is my screen visible?
Yes, ma'am.
Is my presentation visible?
Yes, ma'am. Now it's not visible, ma'am.
Hello?
Yeah, ma'am, now it's visible.
Hello.
Ma'am, stop sharing and again sharing.
Hello. Ma'am, screen is not visible.
Hello? Just a second.
You can stop the sharing, then again you can share the screen. That is no problem.
Just a second. Hello? Yeah, is my screen visible?
No, ma'am.
Please stop sharing, ma'am, and again try to share, ma'am, please.
Okay. Just a second, sorry.
Yeah, ma'am.
Huh. Okay.
Yeah, ma'am, now it's visible.
Now it's visible? Yes.
Ma'am,
Now it's visible?
no, ma'am, no.
No.
चालू है स्क्रीन शेयरिंग तो सही है
Ma'am, that PPT is on your desktop.
Yeah, it's on the desktop.
It's open, ma'am.
Oh yeah, it's open.
So
Just a second.
you click on that particular task button.
Yeah, I'm
Yeah.
because
No, screen sharing option is there, but your PPT is not visible to us, ma'am.
yeah, but now it's open. Now it's visible.
No, ma'am, no, it's not open. Only the sharing option is there, but your PPT is not visible to us.
Okay, so what we can do? Can we share that to you? That is one option.
Yeah. You can
Yeah.
share with us. Then I will present.
Okay, fine.
Yeah.
Just a second.
Okay.
Sorry for the technical problems.
No problem, ma'am. Ma'am, stop sharing.
Hello, yeah. Hi everyone. So I have shared my PPT. Meanwhile, we'll just start. And I hope I'm audible now.
Yeah, ma'am.
Yes. Okay. Just a second. Fine. Yeah. So today's topic, what we have chosen is overview about the women health issues. And nowadays, yes, as we know that health is a very important aspect for everyone's life, not just a woman. Because we now see we are going through the pandemic since last 2 years, and it is so much difficult to tackle the situation. And when we know, when you have your baseline basic health intact in place, it is very important that we can tackle these kind of emergencies or these kind of problems. And then women health is into that, it is more important, because when we talk about the women's health, it is not just a particular person health, it is called as WHO has defined basically women health as the population health. Because it is when we talk about the female, so particularly she will, when she will take care of her health, it will be about her kids, their health, it will be about whole family. And that's why it is very very important to give a focus, to give importance to the women health. So there are so many things about it. As we know that health has been defined as a state of complete physical, mental and social well-being, and it is not just a absence of disease. So whatever is the definition which is given by again a WHO, so they say it is not just absence of disease, how you have your general state. So can I have the next slide please? Yeah. So what is the definition? Is a state of complete physical, mental and social well-being, and not just absence of a disease or infirmity. And as I was talking about women's health, it is completely different from that of the male in many unique ways. It is because of the difference in the body structure, of course, but because women is a center of the family and she takes care of all aspects. So that's why it is the example, it is considered as actually a population health. Can I have the next slide? Yeah. So basically, now what are the key factors? I mean, what is the difference between that? Like how it is differentiated from a particularly male health or man's health? So worldwide, women live an average 4 years longer than the men. And as you know, when the life expectancy is more, the more time we need to be healthy. There are different issues which will come at a different age groups. There will be more problems whenever at the older ages. So we should be able to tackle all those things. So it has been, seen that in 2011, women's life expectancy at birth was more than 80 years in 46 countries, but only 58 years in some, African region. Of course, it is different from region to region, races and everything, genes. And they have lot of problems like more of a sexual abuse, then road traffic injuries are more, it has been seen basically. So these are all the surveys when the WHO present in their health related things. Can I have the next slide? And there are so many, because women have to go through the different phases of the life that we will come to. Okay, what are the different problems? So when she goes for the pregnancy and the delivery, though it is the normal physiological thing, but yes, of course, it is seen that there can be a lot of complications, and it is the risk. That's why it is said that when going through the pregnancy, delivery is kind, and returning back, it's kind of a rebirth. That is because there is a risk of the mother's health also, and there are many maternal deaths every year. It has been still seen, and there are so many initiatives government is taking to prevent these maternal deaths. And at the same time, even though we say that cardiovascular disease and all, it's a male problem, but it is not like that. It is more of it's a number one killer basically in the women, and that is because of the hormones and all that we will discuss. And at the same time, cancer related, most common cancer we see is a breast cancer. So basically these are some key factors, that these are the problems we need to tackle when we talk about the women health. As a gynecologist, when we deal with the women related issues, so we deal from all the aspects, like it starts from the birth, then the so that is very like childhood, infancy, childhood, then adolescent girl, then when they are achieving the puberty, then going into the young adult, then reproductive age group, and then the older age groups. So it is quite a lot of the vast scenario, and that's why it is a very unique problems to deal with. And at the same time, there are many social issues because of the social structure. Still, what we are facing in the developing countries, women need to face that also. So why? So I'm really very happy, to choose these kind of topic, because at least we should be aware about it from the student level, and then accordingly from our different fields how we can deal with that, so that how we can have the I mean, while dealing with the women, what can be the problems and other things. So basic, when you have all the overview from the beginning, at least the awareness will be more when we are dealing further. So next slide, please. Yeah, so here there is basically, as I was telling, there are problems which are in total because of the women. There are there, like for example lifetime, like say gender violence, then certain occupational environmental hazards, mental health problems like depression. And at the same time, when we see that it is like what you can say, because different age groups will have a different problems. So for example, like this infancy and the childhood, that is between say 9 years up to 9 years of age, from birth to the 9 years. So right from the sex selection there is a problem. Like as we have heard, there was one time where it was a lot of problems of the female feticide. That means they used to, so there was when initially, of course, in 80s and all, there was nothing to diagnose about the baby's birth defects or anything when baby's inside the mother's womb. And then with the ultrasound, that was a boon. But in early 90s, the problem was people used to use that to select the sex of the baby. And if it is the female fetus, they used to have the abortion, and that was a great problem. And then the revolution was, there is something called PCPNDT law, so we, that is now very strict and we have to follow. So for so you will notice, for any ultrasound which is in the pregnancy, that each and every ultrasound is notified to the government till the central level, from the state local authority to state to the central. And as a doctor, when we are doing a sonography, we have to give the declaration that we are not doing the sex determination. Then the patients, they have to give the declaration that they are not asking for it. So it is kind of, the problem starts from there, so from the womb. So it's a problem of the sex selection, female feticide, genital mutilations and all, and discrimination, so giving to nutritional problems. So that happens, that is still more in the rural area, more in the developing countries, but still we are facing those kind of problems. Then when she goes to the next phase, and this is a very unique phase, and different problems, especially in the female reproductive life cycle, female life cycle basically. So when she goes to the adolescence is a pubertal age group, young adult, I mean 10 years to 19 years. Okay, so in that, the first and foremost changes in the female, body structure, attaining puberty, and the menstrual cycle problems can come up at that point of time. And at the same time, in the developing countries like us, now we are focusing, because here we are discussing the scenario in India, not, we don't want to discuss much what happens outside and all that, because we have to see the problems around us. So basically the problems related to early childbearing, unsafe abortions, then sexually transmitted infections, HIVs, and undernutrition. So these are the problems female they face in this particular age group. And then comes further reproductive years. So reproductive years are considered as between the 15 to 49 years. Then, as I was explaining, the pregnancy related problems, every female when she goes through the pregnancy, though it's a normal physiological process, but it is not always very safe for females. It can vary, and there can be the problems. There can be even the problems of the unplanned pregnancies. Now, more focus nowadays, more problem because of the decline in the fertility. Problems of the infertility are also quite a lot of there. So initially, now it is the separate branch which has come up, because initially the problem was of the fertility control, so that problems of the family planning and contraceptive use, access to those services. But nowadays, good part is women are getting empowered, then more education, and they are getting independent. But with that, when they are delaying their age of the marriage, or age at which they consider for the pregnancy, and then the problems of infertility will come up. And still it is a very very big social stigma. Whatever is the education, we face that stigma, that mental agony, and they have to sometimes go through the advanced treatments like in vitro fertilization, that is IVF, test tube babies and all. So it is also a big problem in this age group. At the same time, again, we have these problems of pregnancy related complication, as I said, unsafe abortions, sexually transmitted diseases, HIV, and of course malnutrition and other part. That also remains because of the discriminatory nutrition. And then when we move on further towards post reproductive years, that is after 45 years to 50 years. So as here now the hormonal changes are again happening, because what is the women's cycle? Women's life cycle is like at the age of 10-15 years she will attain a menarche, that is menstrual cycle will resume, and after that again she will enter into the reproductive age. And at the age of 50, because of the, that is the normal physiology, normal body structure, that the menstrual cycle will stop and the hormones will go down, and because of which she will have that is something called as a menopause. That is no menstrual cycle, lack of hormones, and because of which she might have other symptoms that we will see further. And at the same time, she is more prone for cardiovascular diseases and sometimes bone related problems like osteoporosis, osteoarthritis, because female hormones are protective from they protect us actually from these problems. And there can be other problems like diabetes, other health issues, as well as gynecological cancer. So cancer is also nowadays a very big problem that we are facing. Now we will, can I have the next slide please? So this was an overview generally what issues generally which we face, and it is so that's why I have divided into different phases of the life, because it is the women's unique life cycle. So these phases, each and every phase will have a different problems. And now why we are discussing all this at your level also, because at least when we are aware about the problems, when we are aware what is there, we can apply our knowledge from our field to tackle these problems, to decide what we can contribute for the society. That's why we are discussing these kind of topics. And now the next, when we talk about infancy and the childhood, so which is infancy is generally till 1 year of the age, and after that the childhood, which is generally till 9 years of the age. So basically it has been seen that death rates, causes of the death are generally same for the boys and the girls during the first few years of the life. And those are mainly why there will be problems, or like up to the death or something, because prematurity, that is having birth early, not completing 9 months in the mother's womb. So it can be 7 months and all, birth weight is low, so baby will have to face the breathing problems. That is something called birth asphyxia. That means while going through the process of the delivery, less blood is flowing to the baby, and that is affecting the blood supply to the brain. And then there can be problems related to, so baby may not cry. You would have heard these kind of situations, baby is not crying, or then sometimes because of which what happens is later on delayed milestones, baby will attain all those so developmental delays and these problems. And very important reason, especially in the developing countries, is infections. So baby is more prone to the infection. So these are during the first few months of the life, and that also increases the risk to the death. And other later on till 5 years also, they have these problems of pneumonia, very common, that is, respiratory infection. It might go very severe, as well as diarrhea, dehydration. So these are the very important causes. So these are the problems that we need to tackle. And malnutrition is a very major factor. So here again, whatever, so this is one phase, and especially this we are talking about in the female life cycle. So same time when the mother of the child, now when we know, so mother of the child, when she has to take care of this, so when we are aware of these kind of problems, so rest other things, medical problems can be tackled. Yes, medically we can prevent that, how we can prevent premature birth, and other things. So that is the medical thing. But simultaneously, nutrition, how we give nutrition to our kids, and then what should be, so that awareness for that female is very important, because then these problems will be prevented. Can I have the next slide? Yeah, so this was about the very early age. Then as I was talking about the adolescence is the attaining puberty and very young adult stage, so between generally teens, 10 to 19 years. Now here, again, there is a change of the life cycle. So start of the menstrual cycle, again there is exposure to the different female hormones. So body has to accommodate. So there, then it has been seen that there are major issues like mental health problems, self-inflicted injuries, and those kind of thing. So maybe because of some because of the hormonal changes also, or how the environment is there around, family environment, some experiences might have they might have a problems like depressive disorders, some tendencies like it has been seen that schizophrenia is also very common in this age group, especially adolescent girls 15 to 19 years. And that is a very basically it will affect quality of the life, and it might lead to other problems like self-inflicted injuries, or also the road traffic injuries and others. So that is because of the different reasons. But yeah, these are the worldwide whatever surveys are saying this. Can I have the next slide? Yeah, and also it has been seen that this problem is little settled, but still HIV is the biggest problem during this adolescence age group, and especially that is in the lower and middle income countries, that is the developing countries. And that is because again, lack of awareness, lack of use of the contraceptives, and people are not at all aware that these kind of infections are there and why they happen. And that is also, it is very much it is associated basically because unfortunately still females, they might face unwanted forced sexual activity, because of which these problems are very, very common. Can I have the next slide? Yeah, and other things. So as we come, because of all those things, so biggest problem is about the adolescent age pregnancy. So basically it increases the risk to both mothers as well as those newborns. And still the rates are quite high. So they have tendency of the unsafe abortions. So when it happens unwanted pregnancy, then tendency is like not to tell anyone, going to the quacks and taking some different remedies, and which lead to either incomplete abortions, and it might even lead to so severe infections that leading to the death also. So that is quite a lot of activities that at the WHO level they conduct to prevent all this, to know, aware about these kind of problems, and then awareness about the contraception, awareness about how she can have the safe abortions. And there has to be some platform where they can report these kind of problems, and she will get a support from the that platform. So that is also very important. So these problems are especially in a countries like us, where the adolescent girls between say 15 to 20 years of age are facing quite a lot. Next slide, please. Yeah, and also nowadays important problem again is the substance use. So because of the peer pressure, more exposure, internets and all that, so these kids are increasingly using tobacco, alcohol, and again, of course, they are compromising their health. Not just now, even the later life also is getting compromised. and it is as high as these percentages are almost as same or sometimes even more than that of the whatever is seen in the boys. So this is very common problem nowadays we are facing. Can I have the next slide? Yes, and again about the nutrition. So as I was telling about discriminatory nutrition, because of the social structure what women have to face, most common problem is the anemia. Anemia, as you know, it is a less hemoglobin, and most commonly it is iron deficiency, which is because of the nutrition, and that might lead to the problems, which is like cognitive problems, physical deficits, as well as the reduced productivity in the adult life. So what is your health in the adolescence, that is going to matter your future life. That is very important. So they are more vulnerable, especially women and girls, because of the insufficient intake of the iron in their diets, as well as during the periods of this rapid growth, they have to face the menstrual blood loss. So there is a blood loss, at the same time you are not getting the adequate nutrition. That's why these problems are very common. But because this is the developing age, they have to face this in their later life, basically. Can I have the next slide, please? Yeah, and then now here the adolescence, when it ends, and then it is like in the adult stage, and especially this is called as the reproductive age group, which is a most important age group. So as I was talking, that one problem, so it is like two divisions. So one, it is related to the pregnancy, yes, maternal health, that is mother's health. So there are so many problems are there, and there are a lot of initiatives have been taken that this maternal health will be maintained, and we can prevent maternal deaths. But at the same time, what is happening nowadays is to enter into the pregnancy is it is taking a lot of time, and that is also giving a lot of burden to the couples, especially the female, and that is because of the social burden also. And nowadays, that's why even the WHO has considered infertility, that is unable to have child, is a social burden and social consideration, where we have to focus on that. Still, we don't have much support groups and much awareness about those issues, because it is nowadays taking up. But now it has been said that what was the concept earlier was the for family planning, because people used to complete their family by 23, 24 years, maximum 25 years of the age. So there was a problem of the fertility control, and that's why family planning had come into picture. But nowadays the problem is because of the late age at which people start considering their family, they are facing the issues of infertility, which is very, very common. And the concept, it's coming towards fertility planning. So from the family planning, it is coming towards now fertility planning. Doesn't mean that to have kids earlier, not really, but it is like to understand where exactly we are on the fertility timeline, because again females have the limited number of the eggs, and they have the limited number of the reproductive lifespan. And that is why how to utilize our eggs, and how to utilize that fertility potential in right time. And you would have heard that with the technology of the assisted reproductive techniques, that is the ART techniques and all, now we can preserve the eggs or preserve the embryos, even they are if they are they want to delay the childbirth. So these are nowadays newer technologies, at least they can help in this aspect. And now when we talk about the pregnancy related issues, so maternal health is important, because maternal deaths are the second biggest killer of the women. So first we have seen was the cardiovascular problem, and the second is the maternal death, because every year still around 2,87,000 women, they die because of the complications of the pregnancy and the delivery. And majority of them, 99%, are still in the developing countries, because that is very important. And at the same time, even though and this can be because of the multiple times they have to go through the pregnancy and the childbirth. So even though the contraceptive, modern contraceptive methods are available and everything, but still at many countries or many places, women, they don't have a proper access. So still we are lacking there. Especially in the African countries and other parts, because it is still lack of awareness is there in amongst the people. Can I have the next slide? Yeah. And other problems, still we are having these problems little less, but tuberculosis is another part. So if because of the malnutrition, and especially in these ages like 20 to 59, so we have seen these infections are still common. It can be linked to the HIV infections, because immunity will be going down in the HIV infection. So this is also one of the problem which we have to face. Can I have the next slide? Yes, and again, this is related to the injuries and all, which is there, like self-inflicted injuries because of the mental health problems, or there can be road traffic injuries, and very commonly even the burns. Okay, so it is like women suffer significantly because of the fire-related injuries, and then the main. So because of the cooking accidents and all that. So this is also a part which we have to consider, especially in the developing countries. Can I have the next slide? Yes, and very importantly, as we were, talking about the female-related cancer, so that is like breast cancer, and another is the cervical cancer. So cervical cancer is the cancer of the neck of the womb, mouth of the womb. So that is very, very common, because it is the second most. So first most common usually is the breast cancer, and this is common. Why in our countries? Because it is related to the sexually transmitted infection, as well as it is something called HPV. And that's why we should be aware about the availability of the vaccines, HPV vaccines. That is very important. So screening, we need to screen that. So we don't have to wait till we diagnose the cancer. So some screening is what? To screen means to do certain tests to find out a problem in the healthy individuals, so that we are trying to prevent these kind of problems. And nowadays the vaccine, even it is like a rubella vaccines and all, it is been added into the vaccination schedule by the pediatrician. So even at the age of, we start these cervical vaccinations, cervical cancer vaccinations, HPV vaccines at the age of 12 to 14 years itself. So from the very big early stages. Can I have the next slide? Yes, and other very social problems are these, like violence. That is also, we women have to face that. So who have been like, physically, physical violence, sexual abuse. So they are facing problems like mental illness, or unintended pregnancies, or abortions, miscarriage. So than the non-abused women. And then again, they are more into the alcohol related disorders, depressions, HIV. So this is very, very social problem, very, very disappointing social problem that women have to face. That is because of the gender discrimination. Can I have the next slide? Yes, and because of this, again, as I was talking, like they have to face more of a mental illness, which is like depression, anxiety, bipolar disorders, and because of the burdens and all that, and then suicidal tendencies are more. Can I have the next slide? Yeah, so these are different surveys, like suicidal attempts, attempted suicide are more, deaths because of that are more. So these are the different surveys globally all over, and in those surveys, people, female have to suffer more than the males. Can I have the next slide? Yes, and other part is of course the disabilities and other thing. So it is like overall 15% of the world's population is disabled, and women, it is more common in the women, and they have the poor health outcomes, then lower education achievements, economical participations will be less, and more rate of the poverty will be there. So again, they might be more, prone to the victims of the violence, and other. They will be more prone to the violence and all. So these are certain problems. Can I have the next slide? Yes, and other problems. This is also very common, which was in one survey where it is they are more prone for the chronic obstructive pulmonary disease. So this is a respiratory, any diseases which are related to the respiration where there is a problem or there is some obstructive problem while having the in the respiration system. So that is why, because of the tobacco use and as well as the burning of solid fuels for the cooking, especially in the rural areas and all, so they might have to face this COPD long term. It's a long term lung disease where later on the lung capacity slowly goes down, and they are more prone for the lung related disorders, and especially they are more prone for the other lung infections also. So women are, because they are exposed to the indoor smoke, especially the cooking and all that in the rural areas. So this is also very common problem. Can I have the next slide? Yes, and then we come to, so this was more of a reproductive age group and all that. Of course, COPD is almost throughout all the ages, but now the older women, so 60 years and more. As I was telling you again, the life cycle of the female will be changing, where she will have to face the hormonal issues because of the stopping of the menstrual cycle, and that is something called menopause. We will see that further. But yes, again, because the life expectancy is more, we are facing more problems of the older age group, that is more of a problems like cardiovascular disease, diabetes, as well as the cancers. They are very common. And so this is very important to know that how the health is important. So how long term you will maintain your health, that will tell us how your health is, how you are healthy in your early 20s will reflect your life at around 60, your sixth and seventh decade. So many of the health problems which is faced by the women in older age group as a result of exposure to the risk factors in the adolescence and the adulthood, like smoking, substance abuse like alcohol, sedentary lifestyle, unhealthy diets, lack of exercises, so all that. So focus is, we have to focus our health as early as possible in your younger age groups. Can I have the next slide? Yes. So this is the very, very common problem, as because of these hormonal changes, women have to face. So initially, at least, like hot flushes, irregular periods, night sweat. So there are many problems. So generally, it is said that, problems of all the systems. So she will have to face all that at the same time. Like, bone related problems, bone density will go down. She's more prone for the fractures, more of a memory related cognitive problems, skin related problems, wrinkles and other part. So again, it is giving a depression, lack of energy, other issues. So all these problems are related to, this, menopausal age group. Can I have the next slide? Yes, and also as I was talking, prevention. So here mainly we are important. So yes, cure is later part, but prevention is always better than cure. So we need to prevent all this. And as when we focus, so why we need to know the issues? Because we can focus to prevent those issues. So when we know about the problem, we can find the paths to prevent those problems. So like for example, importantly, breast cancer prevention, cervical cancer prevention. So we need to do certain things, like we need to focus ki obesity, we have to kill that. So exercise, good nutrition, good diet, no discrimination. Then so even the not having children is also again giving a higher risk for the breast cancer. So basically, at least after once you have the pregnancy, breastfeeding is promoted, because breastfeeding is prevention for the breast cancer. There shouldn't be substance abuse like alcohol, smoking, and other part. Of course, hormone replacement, hormonal therapy is to be used with the doctor's advice and in the limited period of the time. So these are all important points for the awareness, where we can prevent them, these kind of problems like breast cancers. And can I have the next slide? Yes. So how we can promote good health. So we just talked about the problems, but it is very important to understand how we can have the good health in this. So it is very important to have the awareness for a particular, especially female. Yes, it is for everyone, as I said. But because of the female, they are the center of the family, and she is going to take care, she is going to make the food. So one is the awareness about the diet. How is the good diet? What should be the focus? Fresh fruits, vegetables, focus on the protein intake, less carbohydrate intake, then good hydration, that is important. At the same time, physical activity. Nowadays, more of a there is a sedentary lifestyle, I agree, but we have to give ourselves at least 1 hour time in 24 hours where you are focusing on your physical activity, exercise, that is very important. And balanced nutrition. So always when we take about the balanced diet, like good proteins like sprouts, then paneer, then eggs, if even the chicken, non-vegetarian people can have that, of course. And then these are all giving us the good protein source. Then less of the fats and processed food, that has to be less, and more of a talk about the fibers and all, salads and fruits. So we should have this awareness, what is there, what should be the intake, and at the same time how you are going to maintain your body's metabolism rate, that is the exercise. So this is very important. And what is the weight status, what is the ideal weight. And at the same time, when we come to then how to prevent this substance abuse, like alcohol, any other drugs, that has not to be used, no smoking. And then good family planning practices, proper planning of your reproductive life, and also good hygiene, yes, to avoid sexually transmitted infections, awareness about that. And at the same time, taking care of your mental health and avoiding problems like depression and anxiety and all that. Positive thinking, meditation, relaxation exercises. So all that is very, very important. So it is very important to make your lifestyle changes, make your lifestyle very healthy. At the same time, take care of your mind, and focus on overall health. So that training has to be given to each and every female, basically, to promote their good health. Can I have the next slide? Yeah. And medically, screening, as I was talking about, screening is the testing in the normal healthy individuals to find out, or early detection about the for the early detection of the problems. So it is something like, as main focus is cervical cancer, breast cancer, and bone related issues. So generally this bone mineral density and all that, BMD, what commonly it is done after the age of the 50, that screenings will be done. Breast cancer screening, generally it should start in the late third decade, I mean. So I can say like from the early 40s. So 2 times in a years, or then later on. Of course, it has to be continued. After 65, it can be once a year. And this cervical screening, that is also ideally from the like reproductive age group, we should be doing it. That is very commonly done as a pap smear screening. Can I have the next slide? Yes. So almost, so we tackled all these issues about different age groups of the females, and they are little different based on what challenges females they face during that that particular lifespan. But at the end, basically, to maintain, so as I was focusing on, most importantly, health promotion. So what is the principle? Good exercise, healthy food, proper sleep, stress-free life, and all that. So basically, to maintain the healthy lifestyle. So once we know these issues, once we know how to tackle it, and we have to focus on these particular aspects. So almost I tried to cover those things. I didn't want to go into much medical details about it, because it is for you to, it is important to know about the different issues and how basically we can tackle that. So if any questions, we can take it. Okay. So can I take the question, because I'm seeing here? Can you explain about, yeah? Yeah, so one question was from Mamta. Can you explain about folate or intake of Folic acid, yes. So this is something, it is folic acid, is the vitamin from the B complex group. And this folic acid intake is important pre-pregnancy and during the pregnancy, ideally, especially mostly for initial 3 months. Now, why it is important? Because folic acid is required for the what you can say, the neural development, meaning brain and the spine development of the baby. So neural tissue, brain related and the spine related cells will develop well when mother is having a proper intake of the folic acid. Because of the folic acid deficiency, basically there are something called neural tube defects in the brain and spine, they have been seen, and these are the preventable things. So when generally nowadays what we do, when any female starts planning a pregnancy, generally 2 to 3 months prior to the pregnancy, we start the folic acid and we continue throughout the planning, and then she continues that throughout the 3 months. Now, why we focus that? Because it is very simple and preventable remedy where we can prevent a big problem. Otherwise, those are such issues where we need to terminate a pregnancy for that.
Hello, ma'am. There are some questions from the
Yes.
chat box of YouTube.
Yes.
First question is, how can use control early birth of child?
Sorry,
How can we control early birth of child?
How can we control early birth of child? Yes. So now, as we were discussing, there is a problem which is called as a preterm delivery, early delivery. Okay, so there are two groups. One group is there is a risk of the preterm delivery. That means any female who have had a prior preterm delivery or any problems in the mouth of the womb and all that, any surgeries done prior, where we know from the beginning that there is a risk. So in such a situation, one is at the 3 months when the pregnancy is going ahead well, there is some minor procedure which is called as the cervical stitch. That means to tie the neck of the womb. That is in simple language. So to tie that so that we are trying to hold the pregnancy for longer time. Secondly, we need to keep the uterus relaxed. Okay, that means there are some medications given. Then her physical activity is generally reduced. She is advised more of a bed rest, and at the same time we prevent what is something called infections, vaginal infections. So there are medications constantly given. Urine and vaginal infections are prevented, which will prevent the early deliveries. Okay.
And some questions are there in chat
Yes.
box.
Okay, so I can see the chat box. So okay, so folic acid we have done. So next question is from the Pratiksha: how to increase blood in the body? Why hemoglobin is low in the girls? Yes. So as I was talking, the girls, what they have to face is the menstrual cycle. Okay. Now hemoglobin is the content in your red blood cells, which is very important to provide the oxygen to each and every cell of your body. So if you want your body to work efficiently, each cell to work efficiently, that has to, get a good oxygen, because oxygen is very important for the normal processes. So that's why hemoglobin is important, because it's a carrier for the oxygen. Now in the girls, as one thing is menstrual cycle is there, so there is a loss of the blood every month. Around 50 ml to 80 ml of the blood, maximum 100 ml, can get lost. So if they have other problems, it can be a more loss also, but this I am talking about minimum. So one is that. Secondly, because nutrition is not proper, so we have to, when we talk about the gender discrimination, sometimes in the rural areas or the lower socioeconomic this thing, the girls will not get a proper nutrition, so they have to face all this. So that's why hemoglobin is lower in the girls, and that is because of the hormones also. But in general, at least we can maintain the hemoglobin more than 11. Which, how can we increase that? With a good diet. So yes, there are the tablets, but that is not always the solution. So good diet, iron rich food, that means you should have the intake of the jaggery, then spinach, and then dates. These are the iron rich food that we have to take, and if it is very low, then the medications would be added. Okay. Then I think the next question is, can you Okay, what measures can be taken to prevent the breast cancers? Yes, so for the breast cancer prevention, very good question. So there is something called a self breast examination. So simply every 15 days, so there are, you will get the videos also how to do the self breast examination. We just have to see if any palpable lump or anything is there, any changes in the breast tissue, that has to be notified to the doctor. And as I was showing you the screening test, so yearly, like in from the third decade, from the 30s, you should have yearly, that's something called mammography, which is the just an x-ray, or also there is something called sonomammography, that is a sonography to check, to see that whether there is any lump or change in the tissue. And when we detect early, we get an actual time, to tackle that kind of situation. So by this we can prevent. And as such, see, basically this is the screening and early diagnosis, but prevention, as I was telling you, what makes exactly, the obesity is a very first killing factor for the breast cancer. So obesity shouldn't be there. That is because it is very common in the obese individual. So you have to have the exercise, good diet, no alcohol and smoking, and at the same time encourage breastfeeding. Whenever she enters into delivery, breastfeeding is really preventive for the breast cancer. Okay, so then what do you mean by loss of libido in a menopausal state? Okay, so menopausal state means, as I was telling, see, hormones are going down, and then your menstrual cycle is stopped, okay, because of which loss of libido is loss of, what you can say, I mean, the feeling for the sexual activity. So they will not be more having those feelings because of these kind of problems. At the same time, they might have the dryness in the vagina and other problems. So that lead to the loss of sexual activity, that is called as loss of libido. Okay. Then next last question, I guess, from the Sonali about the thyroid. Is it a permanent or temporary disease? See, basically it depends upon now thyroid. There are like hypothyroidism, hyperthyroidism. Okay, so but generally when we talk about thyroid very grossly, so that means you are requiring the thyroid supplements. It all depends upon how much is the level, how much is that TSH hormone is increased. If it is quite a lot of it, might be permanent. Yes, because you need the hormonal supplement. Your thyroid gland is acting, the activity is reduced, so we need that supplement. But it is nothing wrong in taking that. If we avoid the supplements, definitely there will be a lot of problems. So it just like it doesn't have any side effect. So this is it's a very common myth. Oh, thyroid, you are taking hormone, means that is something problem. No, so it's just a replacement of the hormone because your body is not producing in the adequate amount. So it absolutely without any side effect. It is in fact preventing the side effect because of lack of thyroid. So yes, it can be majority of the times permanent. Temporary is, which is something called subclinical hypothyroidism, that is generally detected in the pregnancy. Okay, so next question would be, in the contraceptive pills and the PCOS treatment pills, is there any difference? Yeah, of course. Now contraceptive pills, it is preventing the ovulation. Okay, but yes, in the PCOD, when certain pills, there are different pills will be given to regularize the periods. When the pills are given only for the 5 days, those are simple progesterones, those are not contraceptive pills, and those are generally safe in the young girls. We generally prevent 21 days pills. When the pills are for the 21 days daily without any gap in that, when your doctor says so, those are generally contraceptive pills. And now as you are all pharmacy students, so you can know the content. So when the contents are estrogen plus progesterones, those are contraceptive pills. So similar are given to control the cycles, but that is not recommended for the long time. So that's why ideally the same pills are given, but not so recommended for the longer time. So PCOS is a disease of the lifestyle. So as far as possible, you try to maintain your weight and good diet. Definitely there will be good regularization of your periods. But still, if it is not and we require a therapy, we prefer only progesterone tablets only for the 5 days. Okay, then the next is why tuberculosis is often linked to the HIV. Yes, because as you know, HIV is attacking our immune system. Immune system means CD4 cells and all. So the cells which try to, they are fighting against the organisms like bacteria and viruses and all that. So HIV is attacking that. So HIV is reducing your immunity. And tuberculosis is a chronic disease. So till the time you are healthy, definitely your body, and we are so much exposed. We, of course, we have been given a vaccination from the birth, but we are so much exposed. It will go through your nose and on respiratory system. And if your immunity is good, then definitely your body will fight it out and it will prevent the infection. But especially like in the HIV, when the immunity goes down, the tuberculosis will definitely then will come up. So that's why that is very common. Okay, so can you tell some essential nutrients for the daily intake during the menstrual cycle? So as I said, yes, it is nothing like in the menstrual cycle. Just a second, yeah. So it is nothing like in the menstrual cycle, particularly in those 5 days, we have to have the essential nutrients. It is in general a good balanced diet. So as the principle of the good balanced diet is the fruits, fresh fruits and fresh vegetables, which will give you a lot of antioxidants and fibers. So high fiber, as well as less carbohydrate, less complex carbohydrate, less sugars, less fat, more of a proteins. Okay, so and good hydration. This is the basic principle, and I will not suggest that that is only during the menstrual cycle, but it is all throughout, ideal. Okay, tool for assessing sexual health for the women living with HIV. So tool for assessing sexual health basically is generally a screen. As they should be screened for the pap smear, they should be screened for, and basically local in what you can say, examinations. Is there any problems? And she should be aware about the symptoms. Okay, so this is very important. So that is just awareness and regular follow-ups with the gynecologist, pap smear, local examination, and at the same time awareness about the use of the barrier methods of the contraceptive, because the focus is on prevention. Okay, so why does period stop in shower? I didn't get this question basically. This question needs little clarity, I guess. Saili, I'm not clear. Okay. Yeah, can be tuberculosis is inherited from the grandparents. Not, it is not a genetic basically, but it is seen that if a particular persons in the household is infected, like grandparents, they are infected, then it is more seen that early childhood TBs are common where the grandparents or the people in the family are infected. So basically, it is not the genetic; it is because of the environment. It's a social environment. Okay. Then during the menstrual cycle, more pain is normal or not? Now, in especially the adolescent girls and the young adults, yes, painful menstrual cycle is common, which is very because of the certain chemicals which are getting released, like prostaglandins and all that. And that's why again your pharmacy application, that's why prostaglandin inhibitor drugs are given for tackling these kind of the pain. So yes, it is common, but it is very severe. Once at least it is better to get checked by the ultrasound. Is there any other reason? And if other reasons are not there, no other problems, no other structural problems, then yes, it is normal, and it can be simply tackled with the some painkiller medications, antispasmodic. Okay, so that is safe to take. What measures to be taken to prevent from the cervical cancer? As I was telling, so one is a screening test, which is a pap smear, which is for the early detection, and for the prevention, very important is the good sexual hygiene, genital hygiene, using the barrier methods of the contraceptives, avoiding multiple partners, and at the same time having HPV vaccination at the earlier age. Earlier is better. Before your first sexual intercourse, it has to be completed. And especially nowadays, it is given at the age of 12 to 14 years. Okay. Then next is taking medications during the periods to control the pain will lead to any further problems. No, As I am telling, those are the simple medications like Meftal spas and all that. Those are antispasmodic. So it is no need to avoid it and to suffer and to, what you can say, interfere. If it is interfering with your work, you have to take a leave from your colleges and work, which is not good. So those are just simple medications which are reducing the pain sensation, because they are tackling those chemicals which are especially the prostaglandin. So those are prostaglandin inhibitors. So obviously there are no side effects for it, and it will never have any further problems during your further future life, or in any future reproductive problems will not arise. So that is also myth. So you can safely take the medications. Can we take it same? So any medications to control the cramps, as I am telling, that is the antispasmodics like Drotin, Meftal spas. These are the simple medications without any side effect. And ideally, you should start those medications from the beginning. That means from the day one. You should not wait for till day 2, day 3, because that is the time where these chemicals start rising. And before they achieve their peak levels, you should, start tackling that. So you can start those medications from day one itself, then it will give you the better results. Okay.
Ma'am, question from YouTube.
Yes.
How often should I get pelvic exam?
It depends upon basically you are at what age. But see, basic thing is we don't per se recommend a pelvic examination. It is during the screening, that is a pap smear. So yearly, I can put it as after you are in your 30s. So from the 30s when we start screening, so yearly you can have. So there is not specific different pelvic examination during your pap smear. It will be screened like that.
Ma'am, next question: how we can understand women have COPD problem?
COPD. Okay. So COPD, that is the chronic, pulmonary diseases. So generally they will present as, any breathing difficulties. She might have the problems like asthma or dust allergies and all that. And she will have more commonly as like difficulty in breathing, especially it might start, okay, especially at night, or if she is walking for some distance, then she is getting, and this is very common again, this COPD related symptoms. So any cardiac disease also at the same time to be ruled out. So basically good physician evaluation is needed, but definitely it is more of a respiratory related symptoms, then that will tell you.
Thank you, ma'am. What is the most common symptoms of menopause?
Yes. So menopause and most common symptoms, it starts with the irregularity in the periods. Either periods are getting delayed or not coming for 2-3 months. And later on, when it is not there for 1 year, you can actually diagnose. At the same time, it can be early, like, irritability. That is because of the hormonal changes, night sweatings at the night. And then there might be, vaginal dryness, vaginal infections, urinary infections repetitively. At the same time, back pains, bone pains. These are the symptoms. There are a lot of still symptoms. Then she might have other cardiovascular risks and other. Those are the risks, but these are more of a symptoms. And that is also variable person to person, and we can't much prevent those. But yes, we can have now, yes, one thing which is, if it is very much bothering, we need to take the hormone replacement therapy. But as I was telling, it is also with the risk, because it is a risk again for the breast cancer and all. So doctor has to be involved. It depends, doctor will decide for how much duration this can be given, which medication safely can be given. But at the same time, prevention would be again similar: lifestyle, good exercise, mental relaxation, and at the same time, phytoestrogens, natural estrogen. So especially the soybean. Soybean contains the natural estrogen. So she can increase the intake in the soybean intakes in the food.
What dietary habit may increase cancer risk for the woman?
Usually dietary habits as such, yeah, because if it is not a good balanced diet, which will lead to the complex carbohydrates, fat intakes, saturated fats, which will give you what? Obesity. And obesity is a very good risk for the cancer. So one is that. Secondly, food more with the preservatives and all, that has to be avoided, because sometimes those are not good. But these are the only things where food with the preservatives and unbalanced diet basically will have the problem.
In women always are in stress, how we can control?
Sorry, can you repeat the question?
Women always are in stress, so how we can control?
Women in phase of stress.
Stress, yes.
Yes. Now, see, as a woman, it's a lot of challenges because it is not just nowadays, because of the multifaceted life. It is a good part that women are getting empowered, more education. But yes, it is adding you the stress. So when you are in your active age groups, you have to tackle work related stress, you have to perform there. At the same time, family related stress, you have to take care of your kids. Then you have to deal with basically, different generations, 3 generations. You have to deal with your generation, that is your spouses. You have to deal with your generation, which is like your kids, which are more smarter. And of course you have to deal with a generation which is a older age group. So this is like it's very multifaceted life that we need to learn to live and to reduce. Yes, so that's why the stress, it is the very common factor. It is going to be there, you can't say it is not there. And so it is like how you respond, that is important. So stress is more, you can't say ki, I don't want to have the stressful environment, I don't have to have the stressful situation. That is not possible because that is out of your control. You can't say ki you will get cakewalk everywhere. So what is in your control? How you respond to the situation, how you respond to your stress. So that is something, it is bigger in your head because you have to understand yourself. So you have to program your mind in such a way that to tackle all the situation calmly. That is very important sometimes because of the female hormones and all. And of course, at the same time, you need to go through the different phases of the menstrual cycle. And that also give you add-on stress, add-on your responses will be related to that. But we need to learn. And for that, important is to control your mind, to have the meditation, good 1 hour of time for yourself, and good diet, balanced nutrition and everything. And at the same time, meditation really helps, and self affirmations, relaxation techniques, and confidence on you. You have to understand that you are self sufficient, you can tackle all this situation. Try to learn to love yourself and give yourself everything so that you can tackle these things. So it is basically, it's a mind game. It's in your mind how you are going to respond.
How often do women need to have whole body checkup?
Yes, yearly. I would say yearly. Yearly has to be there. So in that, then all the screenings for the cervical cancer problems, breast cancer, and there are other related thing. So if everything is, she's at normal health, then yearly. Okay, so I think 2-3 questions I can see in the chat box. We can quickly finish that. So early menstrual cycle can lead to any problem in the future? Yes. Nowadays, what is happening is menstrual cycle is coming little early. That is because of the changes in the diet and environment and all that. Generally, what happens now, when the menstrual cycle starts, your eggs are getting utilized, and that's why early menstrual cycle lead to the early menopause. So that can be some problems there, and it is very difficult at the age. So menstrual cycle, having a menstrual cycle at the age of say 13-14, and that time to understand it and tackle it, and having menstrual cycle at the age of 9 years or 10 years, it is little difficult. So mentally it is difficult, it's a challenging. That is one problem. In future life, it can be early menopause also. But we per se can't much prevent about it. If it is too early and giving up any problem, then certain hormones can be given to delay the menstruations. But that is fine. But that is the only problem in the future she can face. Now, older women face the knee joint pain, ankle inflammation. Why it happens? And what kind of daily routine suggestions are required? Yes, older women do face this because the estrogen hormone, which is the bone preserving hormone, which will deposit the calciums in the bone. So when in a older women there is a menopause, estrogen level is going down, the less calcium is getting deposited in the bone, and there is a deficiency. So we need to regularly have supplements like vitamin D and the calcium's milk curd intake. And with that, if it is quite a lot of pains and all that, so with the expert advice physiotherapy and exercises which are safe during that particular condition, that has to be used. And inflammation is sometimes because of the high uric acid levels and all, so that also you need to get it checked with the doctor, and accordingly dietary changes can be done. But yes, basic dietary supplements are required after the menopause, like a calcium and the vitamin D. Now, white blood before the period is good in large amount. Now, see, white blood is nothing but the vaginal discharge. So, some amount of the vaginal discharge is the physiological, which is common. But if it is, the thing is, if it is foul smelling, if it is giving itching and foul smelling and itching kind of the symptoms, then definitely it is abnormal. You should get and checked with a doctor. Okay. Then next, is it okay to work out during periods? Or yes, of course you can do workout during the periods, during weightliftings and everything. It is a normal thing. You need not stop your daily routine. Very well, you can do it. There is no need to take rest or something like that just because of the periods. Only thing, as it is a discomfort if you are having the painful periods. But yes, start tablets and all that, as I was telling, from day one, and be normal in your routine. There is no need to stop that. Now, in health screening, any alternative option is there other than ultrasound? Now, for what? Health screening, yes, ultrasound, as I said, for the breast. Now, if it is instead of the ultrasonic examination, it can be X-ray, sonomammography. The other and ultrasound otherwise used is where it's like your pelvic ultrasound. So for that, if it is like more invasive, is a CT or MRI. Ultrasound is a very basic thing. So ultrasound is the safest one. There is no radiation exposure about it during that. Sorry.
Ma'am, some questions from YouTube.
Mhm.
How long do menopause symptoms usually last?
Yeah, now again, it is a person to person variable, but generally, if it is happening a little at the later age, at say around beyond 47, 48, so it might last for 2 to 3 years with a different severity. Okay, and depending upon how females are able to tackle how severe the symptoms are, what kind of symptoms, then the treatment would be suggested. I mean, hormonal. Otherwise, there are these basic, as I said, dietary changes and other things. So that is there. If there is something called early menopause also, that is a premature menopause where the menopause is happening before the age of the 40. As there was one question, if the periods start early, then the ovarian reserve will get exhausted early, and then there can be early menopause. Yes, in that time, definitely the major problem will be what? Yes, symptoms is one part, but the bone health, cardiovascular risk, it is going to be more because estrogen hormones are lower. So in those especially, then you need to consult your doctor. That time we need to give some hormone replacement therapy, which is for the betterment of the health. So those symptoms might last little more when the menopause is early.
What are the preventive measures for PCOD?
Yes, again, PCOD, as I was telling, there is no cure for that, and we don't know to whom it will be there. So everyone, we can say, is at the higher risk. So basically, preventive measure, very good question. It is how to maintain, like maintaining your health in a better shape. That means 1 hour of the good exercise. It includes either any kind of workout, yoga, walking. That is very important to have regular, not even a 5 days in a week, every day in a week. That is important. Secondly, diet. So diet is important, where again this one, so you need to basically maintain your weight. That is important. And now sometimes one type of the PCOD is patients are very lean, like them thin built, but still they will have. So at least, but when you have good exercise and diet, definitely the problems related to PCOD will be less. So these are the preventive measures.
Ma'am, systemic lupus erythematosus, whether it is genetic?
Yes, SLE. Yes, it is the autoimmune disorder. So it is a genetic, not all the types, but yes, there are different types of it. Majority are the genetic types. It can lead to from mother to the baby also. Especially babies might have some heart related, conduction defects and all in cases of the SLE. But we can very well tackle. She can still carry a pregnancy. But yes, it is a genetic disorder.
Ma'am, some questions are here in chat box.
Yes. In the chat box, I will see. Okay, ultrasound was done. Is it okay to have 3 to 4 days early or delayed periods from the date of the periods? Yes, it is fine. This is fine as long as you are not in the, planning the pregnancy, not in the in the early young adult stage. This is fine. But when you are in the reproductive age group and especially planning the pregnancy, and if these kind of changes in the periods are there, you need to notify the doctor, because the ovulations are not regular in such a kind of the cycles where you might need little help to regularize the ovulation, but otherwise it is normal, nothing to be worried about it. While having a bath, why bleeding stops during the menstrual cycle? See, that is fine. Now what is there, it is nothing like while having a bath completely, but it is a phase wise bleeding, and it is not like a, uterus is completely open. It's a muscle, it's a valve, so it will get accumulated in the uterine cavity slowly, and then at one point it will come up. But that is just a coincidence. Like during the bath, you say ki bleeding is stopped while you are passing urine, while you are passing motion, then there will be more bleeding, because obviously you are giving a more pelvic pressure. It is nothing related to that. It is just like a phase wise shedding of the endometrial lining. So that usually is not, it's just a coincidence. What are the symptoms of menopause? I think so that we have spoken, that symptoms of menopause are because of the less hormones. So that is like, irritability, night sweats, more of a bone related pains, and it might lead to, vaginal dryness, vaginal infections, urine infections, back pains, and more common problems would be cardiovascular diseases, osteoporosis, that is bone related problems. So these are common symptoms. Is tampon safe to use? Yes, it is very safe to use. You can use it, but you should understand how to use it, what is the proper size, and the hygiene. That is important. Now, why depression occurs in lifetime health problem? Now, as I was telling you, because of the multifaceted life of the female, where she has to tackle everything, work related, family related, plus the social problems in the female life. These are that's why in a female it is more, they are more prone for the mental health illnesses and the depression. So it is all up to how you are taking care of your physical and mental health. That is important, and that's why we are talking about the issues, so that we are aware these are the issues these females in general they face. So how we will build up our good mental and physical health to keep us away from all these mental health problems. Yeah, any other questions?
Ma'am, if bleeding in the period is one day, then it is issue of concern?
It can be an issue of concern. It depends upon the age, but yes, it is always sometimes if there is a less shedding, we need to understand, is there any problem from the uterus, or is there any hormone related problem from the ovary. It can be a concern if she is planning for a pregnancy. So definitely, once the gynecological opinion, hormonal checking, and the ultrasound examination is required in such a cases, if the bleeding during the period is less than of say 2 days or something. Okay.
Ma'am, one more question. If mother is having sickle cell trait, then there are chances to get disease in child?
Yeah, see, it depends upon, now, as you know, mother is having a trait. We need to understand the HB electrophoresis report of the husband. So if the husband is having a trait, because sickle cell is autosomal recessive disorder, so we require 2 genes in the particular person to express this as the disease. Trait means very minor change which will not have any problem per se to the person. They are just a carrier. Now, if the husband is having the trait also, 25% chances that baby might have the disease. And disease will be very difficult. So we need to, in such a situations, first of all, the screening of the electrophoresis, that is thalassemia, sickle cell screening, should happen in fact before marriage itself. Okay, that is very important. But if it is not happened, at least once they are they are planning, or if it is not, at least as soon as she gets pregnant, it should be done. Now, if suppose now she is pregnant, husband is straight. If the husband is having normal, then there won't be a problem. Baby can be a trait, but that is not the issue. But to find out the disease, then we need to take the cells from the baby, which is called as chorion villus sampling, CVS, or amniocentesis, and then to find out the baby's chromosomal composition or whatever hemoglobin composition. That is one option. Second option is something called IVF, embryo biopsy. So when we do make the pregnancies outside, that is in the lab. So we take the egg from the female, we take the sperm from the female, we make the pregnancies, we take the biopsy. That pregnancy cell will be checked to whether it has the sickle cell gene or not. And if it is there, then we discard that embryo. If it is not there, then we transfer. So these are the technologies nowadays to avoid those problems.
Ma'am, almost we covered all questions.
Yeah, I think 2-3 just are there in the chat box.
Yeah, ma'am.
So during vaginal infection, is it good to use cleansing product? Yes, because cleansing products they will maintain the vaginal pH good. So in fact, they will prevent it. But if you are having any irritation and redness, or by using there is a problem, then obviously you first have a consultation with the doctor, treat it, take the proper antibiotics, and then you can use. But without any symptoms, if it is not irritating the particular area, then you can use those products. Then how estrogen plays a role in a calcium deposition during the menopause. Now see, estrogen hormone, it is important to maintain the good bone health. So basically, estrogen helps more of calcium to get deposited in the bone. Now in the menopause, it is going to because estrogen is deficient, it is going to go down. So the calcium deposition will be a problem. So we need to add on the supplements and other things to make your bones more strong. But definitely now, according to the question, how estrogen plays a role during menopause, means if we are giving an external estrogen, that means that's why I was talking that time. If suppose there is an early menopause, then we need the estrogen therapies to prevent these bone related issues, basically, because this is a basic function of the hormone. Okay. Does the irregular periods are due to more estrogen release or due to less progesterone? So see, basically we can't say like because of the more estrogen release or due to the less progesterone. Irregular periods are because of the unovulation. Normally when the eggs are growing, it is getting released. Now when the egg grows, egg itself will produce, the cells of the eggs will produce estrogen, which will act on the uterus lining. Whenever there is an ovulation, then there is a release of the progesterones from the eggshells, and then that will, if the pregnancy is happening, that will support the pregnancy. But if there is no pregnancy, that progesterone level will go down and there will be periods. So basically this is the normal physiology. So that is not, so up and down of the estrogen and the progesterone level is because of the unovulation. That is, this is not regular, and that's why these irregularities happen. So per se, it is irregular periods are not because of the estrogen progesterone imbalance. It is because of the imbalance of the FSH-LH hormones, which is from the brain, which is controlling the ovary, and that leads to the imbalance of estrogen progesterone. Okay. Hello. I think your voice is, your mic is mute. Hello. Yeah.
Thank you, ma'am. The session was very informative. On behalf of NCRD'S of Pharmacy, I express my sincere thanks to Dr. Snehal Madam for giving a valuable time for our students. It's need of today's generation to have awareness about the human health issue. Yes. So thank you very much, ma'am. Have a good day, ma'am.
Yes, thank you so much for having me here for today's session. I'm really sorry for some technical problems at the initial end, but yes, it was really, I really appreciate a lot of questions. I mean, That was really good from the students, end, that from all the levels, all the small points, actually they were asking questions, and I really appreciate that. Thank you so much for inviting me here.
Thank you, ma'am. Here we conclude this session. Now the next session, we will meet at 2 p.m. Please join on the same Google Meet link and YouTube link for the next session. Thank you. Thank you very much.
Thank you so much. Okay, bye. Have a good day, everyone. Bye bye. Yeah.
Good afternoon, madam.
Yes.
येस हर्षल सर कशा आहात?
नमस्कार सर. हा मजेत सर.
येस ठीक आहे. चला हॅपी टू सी यू.
हो.
लॉंग टाइम ऑनलाईन मध्ये. चालेल.
काय म्हणता?
काय ठीक चाललंय. हे वेबिनार आहे मुलांसाठी काहीतरी करावं चांगलं.
नाही चांगलंय.
सगळे आपले एक्सपर्ट लोक काहीतरी 4 गोष्टी सांगतील.
हो आणि त्यानिमित्ताने आपलं पण नॉलेज त्या निमित्ताने अपग्रेड होतं.
हो आणि स्टुडंटनी काहीतरी शिकावं यातून त्याचं एकच मेन गोल असतो.
हो बरोबर.
त्यांनी काहीतरी 4 क्वेश्चन्स विचारावे, त्यातला नॉलेज मध्ये भर पडावी.
बरोबर. हा
ठीक आहे. केव्हा सुरू करताय मॅडम?
Yes, sir.
ठीक आहे करा.
Very warm good afternoon to everyone. Today it's my privilege to have host for this beautiful afternoon. I, Shubhangi Katkade, lecturer, NCRD Institute of Pharmacy, heartily welcome you all in second session of state level 3 days webinar series. When you truly understand that your food choices are powerful and life-affirming, you can exercise control and restraint without deprivation. With this beautiful quote by Marlene Edelman, herbalist, I welcome Dr. Harshal Sir. Dr. Harshal Sir is currently working as an assistant professor with Dr. L.H. Hiranandani, College of Pharmacy, Ulhasnagar. Sir has 16 years of experience with teaching and industry research. Sir has worked as head of the Department of Quality Assurance for 6 years. Sir also worked with various pharmaceutical industries like Medley, Chirag, Alkem, Research Centers, Mumbai. Sir has published more than 70 research and review articles in various national, international journals of repute, and also presented various research papers in national, international conferences, symposia, and workshops. He has 2 Indian, 1 US, and 1 international patent to his credit. He is on editorial board and reviewer of various national, international journals. Sir has guided more than 25 M.Pharm students. Dr. Harshal Pawar has authorized uh, Sir has authorized 8 books in his field of pharmaceutical sciences. Sir is life member of Association of Pharmaceutical Teachers of India. Sir also completed MD in Alternative Medicine, Diploma in Naturopathy and Yoga Sciences, and Diploma in Ayurveda and Yoga and Panchakarma. So, with this warm greeting, I would like to invite Dr. Harshal Pawar sir. And now, sir, I will request kindly proceed for your session. Over to you, sir.
Okay.
Thank you, sir.
Thank you so much, Shubhangi madam, for such a wonderful introduction. First, I'll just share my PowerPoint present. Can you able to see my screen?
Yes, sir.
Okay, thank you so much. So at the outset, I would like to say thanks to the management, principal, Dr. Pingle and Shivangi madam for giving me this opportunity to interact with all of you on such a beautiful topic that is herbs as a health food. These are the contents which today I am going to discuss with you. So I'll give first of all the general introduction about some of the general terms. Then I'm going to discuss why this herb or foods they are given special importance, especially in promotion of health or in treatment of certain diseases. And then we'll going to discuss two important components. One of them is functional food and second is nutraceutical. Right? Most of the times these terminologies they are very frequently used When when you are talking about herbs or herbal foods or food component, food supplement, dietary supplements, uh, we'll also focus on the some of the regulations which are especially applicable in India for dietary supplements and food products. Then I'm going to present some of the herbs or herbal components which are used as a food component or as a part of nutraceuticals. I'll also going to present one case study wherein you can understand that how the various components they are used or incorporated into the nutraceutical formulation or preparation. And finally, I'll going to conclude my presentation. So, by taking into consideration the audience, I have tried to make the slides very simplified, right? So that diploma students they can very easily grab or understand the basic underlying concept which is there, especially in design and development of these functional foods or I'll say nutraceuticals. Right. So first, we will start with a very simple and common term which we are using in day-to-day life, right? And I hope some of you must have studied in health education and community pharmacy. That what is health? Right. So health is a state of complete physical, mental, social well-being, and not merely an absence of disease or disorder. Right. So, in the definition, it is clearly indicated that any person, if his physical, mental, and social state it is good, right, and if he is free from disease or a disorder, then you can call him as healthy person. Right. So here, these three dimensions of the health, especially physical health, mental health, and social health, all these three dimensions they are correlated or interrelated with each other. Most of the times the mental health as well as social health it also even to some extent depends upon your physical health, right? And in order to maintain this physical health in a good condition for entire life or for longer duration of period, you need to take help of some of the dietary components, right? Maybe in the form of nutraceuticals, maybe in the form of dietary supplements, or in simpler term, you can call it as a healthy diet, right? Unless and until your diet it is balanced, balance in terms of nutrition, balance in terms of various components like vitamins, minerals, and at the same time, there are certain components, certain ingredient which we cannot able to synthesize in our body, right? So sometimes we need to take it from outside, right? So unless and until you fulfill it from outside, you balance it from outside, you won't achieve this physical health, right? So and if your physical health is not good, then obviously it will have impact on other dimensions of health like mental health, social health, and other dimensions like environmental health, occupational health, and financial health. So one of the important component which we are getting from the food which we eat, that is what nutrition, right? And how it promotes or how it supports to maintain the health. The first way is uh, uh, first and most important advantage or benefit what we are getting it from the nutrition is that we are developing resistance to the infection, right? So in another word, if I'll say, it helps us to boost our immunity, right? Apart from this, it also helps to promote the health. It reduces the mortality and morbidity. Sometimes in some kind of diseases or disorders, it offers us a specific kind of protection, right? At the same time, it also helps in growth and development of various organs, cells, tissue, or different components of the body. Let us understand now what is food. Right? So any edible material that supports growth, repair, and maintenance of body. So such a component, such a material, such a substances, we can call it as a food, right? And whenever we are hungry, we generally take the food, right? But not necessarily that we should be hungry, right? Even most of the times, even though we are not hungry, we are taking some kind of foods just to fulfill some of the requirement or need of the body, maybe in terms of nutrition, right? So those kind of substances, components, they are also classified under the category of food. Right, so food is one of the major source of nutrition what we are getting and what we are requiring to maintain our normal health. Now let us see how all these components like food, nutrition, and health they are interrelated with each other. Right. If you will have just a flashback, if you look at the history of development of medicine uh, or even food products, nutritional products, or nutraceuticals, then you'll see that initially before 1900, so this was the era where the industries there they were more focused on development of some of the medicinal components, especially from the category of antimicrobial agents or what you can say bactericidal agents, germicidal agents, or even drugs or components like bacteriostatics, like your sulfonamides or sulfanilamides. Right, during the era of 1910, here somewhere it was found that some of the diseases or disorders we are getting it because of a deficiency of some of the vitamins or minerals, right? So then from medicine, the focus was a little bit shifted towards development of such a formulations which contains vitamins and minerals, right? So multivitamin preparations, then they come into existence, and industries and R&D centers they were they started working on this area, right? After this, if you look at the era between 1950 and 1960, there it was come into the light that because of some excess consumption of some of the dietary components, there there were development of certain non-communicable diseases, right? And then there was from especially 1950 onwards, you will see the development in terms of food products or dietary supplements. Then you'll come to know that the major focus was there basically in the development of functional foods and nutraceuticals, right? So here basically the focus was apart from providing you the nutritional components, uh, these dietary supplements or functional foods uh, were also investigated for their therapeutic efficacy in the treatment of certain lifestyle diseases or disorders, like your rheumatism is there, cardiovascular diseases are there, then diabetes is there, right? And so many other diseases or disorders, especially which are related to the lifestyle. This is one interesting slide which I wanted to present here. So you can just look into the look onto the slide. Here I have pasted one photograph of a great physician, a Greek physician who was also known as father of medicine, right? And in 460 to 370 BC, so during this period, he has given a very popular and well-known statement, that is, let food be your medicine and medicine be your food. Right, and this is very important statement, and till date we are uh, uh, till date this particular statement or sentence, it is having a great significance, right? If you look at the current situation, so many of us we are going away from what we are getting from the nature, right? And that is the reason most of us we are suffering from lot of diseases and disorders, right? If we will follow the philosophy which was proposed by Hippocrates, that let be let food be your medicine and medicine be your food, then I think we can avoid, we can prevent lot many diseases and disorders, right? So it is always said that prevention is better than cure, and for preventing us from lot of diseases and disorders, we have to take help, take support from the things which we are getting it from nature, right? Maybe in terms of food component, maybe in terms of herbs. Now, why I'm telling you to have the herbal food or herbal components rather than synthetic drug? So, if you look at the past, right? So many literatures have been published. So many data you will get pertaining to especially safety, toxicity, and efficacy of some of the synthetic drugs, like the drugs from the category anti-cancer, anti-diabetics, anti-psychotics, right? In case of anti-cancer drugs, there is well-established evidence which is published in earlier literature that these drugs, they are having a toxic effect on the heart, on the lung, and various vital organs of the body. Similarly, you can also see for anti-diabetic drugs, right? So these, no doubt, you are getting benefit of those drugs, but at the same time, I'll say in certain cases the side effects or the harmful effects, they are also equivalent to what the benefit they are offering after their consumption, right? In case of antipsychotics also, you will see many a times if you are consuming the antipsychotic drugs for longer period of time, that may leads to weight gain, development of cataract, right? Sometimes it also leads to the development of diabetes, right? There are lot many sexual side effect. It also increases your cholesterol level, lipid level, right? And it is also having bad effects, especially on the cardiovascular system. Right? One of very surprising thing I'll tell you here, that if you will refer the literature or the package insert of some of the antipsychotic drugs, it is clearly mentioned that these drugs will going to develop even the suicidal tendency in some of the patients, right? And if such a dangerous side effects are there, adverse reactions are there, harmful effects are there, then why should we go for synthetic drug, right? I'm not against manufacturing or selling of the synthetic drug, but I am saying that only the cases where it is really needed, we should go with the synthetic option. Otherwise, nature has given us lot many beautiful herbal components, right, which we can use to cure, and not just for treatment or for curing the diseases or disorder, but you can also yourself prevent from getting those diseases or disorder, right? So what are the advantages which are offered by herb that we're going to see, right? So why one should go for herb and food and not for drugs? So these are the reasons that herbal components, herbal materials, right, they are less toxic. Some of these components even they are non-toxic, right? Why I'm saying this? Because since long time we are using the food products, many food components in our daily diet, right? So their safety and efficacy it is well established, right? And it is known to us, right? At the same time, lot of data pertaining to their safety and efficacy it is already published earlier and it is there in the literature. Most of the components, phytoconstituents, which we are getting it from the herb or the food, they are biocompatible, right? So they do not cause any kind of harmful or bad effect until and unless you are consuming that particular component or ingredient beyond a particular dose or beyond a particular limit, right? So anything in excess if you are consuming, that is toxic or poisonous, right? So this is what says the thumb rule, right? And it is also applicable to the herbal components or herbal product, right? At the same time, these herbs or food components they have no or I'll say less side effect as compared to the synthetic molecules, right? And most of these components they are easily available and very least processing is there, especially in the preparation of these food products or herbal products, or I'll say dietary supplements or nutraceuticals, right? So since less processing steps are there, uh, uh, so that will definitely going to reduce the cost of the final product or the finished product, right? Here one photograph or one picture you can see here on this slide wherein you can see that if you are using the synthetic drugs or synthetic medicines, right? These are the different bad effects, right? So some of these synthetic medicines they may even damage your DNA. They may leads to inflammation. They may leads to oxidative stress. Sometimes some free radicals they are even generated in our body and they may leads to they may even attack on the vital organs, tissues, or cells of the different organs, right? So in that way, sometimes chronic consumption of these medicines may leads to development of a newer kind of disease or disorder that you generally doesn't observe with the conventional foods, nutraceuticals, as well as dietary supplements, right? So you can see here the benefits which are offered by these components, like it improves the health, it delays the aging process, right? You must be knowing that the free radicals which are generated during the different stress condition, right? So they are even having an impact on the aging process, right? So this can be delayed by using certain antioxidant components which we are getting it from the herbal sources. It also have the reduced side effects. It increases the expectancy and most of these components they are having desirable physiology, right? So these are the options which are available with us in terms of food or food products or food components, right? One of them is a traditional diet which is reported in most of the traditional literatures, right? And most of the Indian system of medicine